If you're over 60 and you still want to feel strong, confident, and in control of your body, this might be the most important health video you see this year. Too many men assume that sexual problems, discomfort, or embarrassment are just part of getting older. But that's not the full truth. I'm Dr. Mohit Kara, a board-certified urologist with over 30 years of experience, and I'm here to tell you, most of the problems I see in men over 60 are preventable. Yes, preventable. In today's video, we're going to break down 10 things you should never do to your penis after 60, and more importantly, what to do instead. Because I've seen the consequences when these small mistakes are ignored. Painful infections, erectile dysfunction, even life-altering surgery. But I've also seen what happens when men take action, when they stop brushing off the early warning signs and start treating their body with respect. This video isn't about shame or judgment. It's about helping you protect your health, your dignity, and your quality of life. Whether you're married, divorced, dating again, or just trying to feel more like yourself, this conversation matters. So before we dive in, I want to hear from you. Type yes in the comments if you've ever felt unsure about your sexual health, or wondered if it's too late to fix things. Your voice matters. And chances are, another man watching this is wondering the same thing you are. And if you're serious about staying healthy, informed, and independent, hit that subscribe button and turn on notifications. I create weekly, doctor-reviewed videos made specifically for men like you. Men who want to age with strength, not silence. All right, let's get into the 10 things you should never do, and how to protect what still matters most. You've still got more life to live. Let's make sure your body can keep up. 1. Never ignore erectile changes. They're more than just performance. As men age, it's common to notice changes in sexual function, but not all changes are harmless or just part of getting older. Your ability to get and maintain an erection is a vital sign of your overall health. It reflects what's happening deep inside your cardiovascular and metabolic systems. What to watch for: fewer or weaker morning erections, less firmness during arousal, difficulty maintaining an erection, less frequent interest in sex. These symptoms may seem small, but they often appear years before more serious conditions are diagnosed. In fact, erectile dysfunction is one of the earliest warning signs of high blood pressure, atherosclerosis, narrowed arteries, type 2 diabetes, low testosterone. That's because the blood vessels in the penis are smaller and more sensitive than those in the heart or brain. So when circulation starts to suffer, the penis is often the first place to show it. If you ignore this sign, you risk missing the early window to detect and treat more serious health problems. According to both the Cleveland Clinic and the American Heart Association, ED can precede heart disease by 3 to 5 years, making it a powerful early indicator. What to do? Track changes in erection frequency and firmness. Don't delay. Talk to your doctor. Request a full checkup, including cardiovascular and metabolic screening. Your penis isn't just part of your sex life, it's part of your health system, and when it speaks, it's worth listening. 2. Never use unproven devices or internet fixes. When something stops working the way it used to, it's natural to look for solutions. But unfortunately, the internet is full of false promises, dangerous tools, and unregulated products that can do far more harm than good. Common examples include vacuum pumps bought without prescription, herbal creams or oils promising instant results, gelking techniques, manual stretching, homemade rings, extenders, or enhancement devices. These so-called solutions often lead to tissue trauma and bruising, long-term nerve damage, scar tissue, Peyronie's disease, erectile dysfunction that becomes permanent. Many men never tell anyone until it's too late, until the damage is visible, painful, or irreversible. The American Urological Association strongly advises against using any sexual enhancement tools, medications, or exercises without medical supervision. What to do instead? Be skeptical of any product promising instant results. Consult a urologist before trying any device or supplement. Understand that proper medical treatment for ED is safe, effective, and often covered by insurance. Trying to fix it in silence can backfire. Real solutions come from real care, not quick fixes. 3. Never skip hygiene. But don't overdo it. Either proper hygiene is one of the most underrated yet crucial aspects of protecting your sexual and urinary health, especially as you age. But too little or too much can both be harmful. What not to do. Avoid washing the penis entirely out of fear, embarrassment, or habit. Use strong, scented soaps or scrub aggressively with rough materials. Skip drying after cleaning, especially under the foreskin. Neglect can lead to a buildup of smegma, bacteria, and moisture, increasing your risk for balanitis, inflammation of the head of the penis, fungal infections, foreskin tightness or scarring. But overcleaning can cause skin irritation, dryness, micro-tears, and disrupt your body's natural barrier. Experts recommend the following hygiene routine. Use warm water and a mild, fragrance-free soap. Wash gently. No need to scrub pat dry carefully with a clean towel. If uncircumcised, always retract the foreskin to clean and dry underneath. Regular inspection is just as important. Knowing what your skin and tissue normally look like helps you spot changes early, like redness, swelling, sores, or discharge. Keep it simple. Keep it consistent. Your hygiene doesn't need to be intense, it just needs to be respectful and routine. Never dismiss pain, bumps, or bleeding. These are red flags, not inconveniences. It's common for men to dismiss mild discomfort, especially in private areas, thinking it's probably nothing, or it'll go away on its own. But here's the truth. Pain, sores, bleeding, or unusual discharge from the penis are not normal. These symptoms should never be ignored, regardless of how minor they seem. Watch for these warning signs. Burning sensation when urinating. Sores, ulcers, or persistent redness. Blood in urine or semen. Foul-smelling or discolored discharge. Lumps, bumps, or thickened skin that doesn't go away. These can indicate urinary tract infections, UTIs. Sexually transmitted infections, STIs. Inflammatory skin conditions, and in some cases, early signs of penile cancer. Too many men avoid getting checked because they feel embarrassed or fear the worst. But avoiding the doctor often allows small, treatable issues to become serious medical emergencies. According to the Mayo Clinic, many cases of penile cancer are fully treatable if detected early. But outcomes worsen significantly when diagnosis is delayed. What to do? If you notice persistent symptoms that last longer than 1 week, see a urologist. If a sore or bump doesn't heal within 2 weeks, get it examined. Don't wait for pain to become unbearable. Earlier care is easier, safer, and more effective. Your penis isn't separate from your body's health. It's a sensitive barometer. Listen to it. 5. Never have rough or uncontrolled sex. Especially after 60, sex can be one of life's most meaningful experiences, even as we age. But here's something most men aren't told. The older you get, the more delicate your penile tissue becomes. It's more vulnerable to injury, especially when erections are very firm or when blood pressure is high. One of the most painful and completely preventable injuries we see is a penile fracture, which occurs when the erect penis is bent forcefully during intercourse. It causes an audible pop, followed by immediate swelling, bruising, and severe pain. This isn't a myth, and it's not rare. Common causes of injury include rough or high-impact thrusting, unstable positions, especially when partner is on top, lack of communication or awareness during sex, poor lubrication causing friction or tearing. A penile fracture is a surgical emergency. It can result in permanent scarring, curvature, and long-term erectile dysfunction if not treated immediately. Harvard Health Publishing confirms that older men are more prone to sexual injuries and that slower, more intentional intimacy leads to better outcomes, physically and emotionally. How to prevent injury. Use water-based or silicone-based lubrication to reduce friction. Communicate with your partner, especially if trying new positions. If you feel pain or hear a pop, stop immediately and seek medical attention. Take your time. Intimacy is not a performance, it's a connection. Safe doesn't mean boring. It means smart, sustainable, and satisfying. 6. Never overheat your testicles. Cool is better for hormone health. Most men are surprised to learn that temperature has a direct impact on testosterone and reproductive function. Your testicles are located outside the body for a reason. They're meant to stay cooler than your core body temperature, about 2 to 4 degrees lower, to maintain healthy hormone production and sperm development. But modern life often keeps them too warm. Common sources of excess heat include sitting in hot tubs or saunas for long periods, placing laptops or tablets directly on your lap, wearing tight or non-breathable underwear, long hours of sitting, driving, desk work on heated surfaces. Over time, this consistent overheating can lead to lower testosterone levels, reduced energy and libido, decreased sperm production, even impaired testicular function in older men. Johns Hopkins. Medicine warns that long-term exposure to heat in the groin region can negatively affect testosterone regulation and sperm health, even in men well past reproductive age. Simple ways to protect your hormone health. Use a lap desk or pillow under electronics. Limit hot tub or sauna time to short intervals. Wear loose, moisture-wicking underwear like cotton or bamboo. Get up and move around if you sit for long periods. Even small adjustments can help your body maintain its natural hormonal rhythm, leading to more energy, better mood, and healthier sexual function. Final thoughts. Because this still matters, sexual health after 60 is not about vanity. It's not about chasing youth, proving anything, or living up to unrealistic expectations. It's about something far more important: your vascular health, your hormone balance, and your mental and emotional well-being. When men ignore this part of themselves, whether out of embarrassment, misinformation, or the belief that it's too late, the cost goes far beyond the bedroom. It affects your heart health, because poor blood flow impacts more than erections. Cognitive health, because hormone shifts and intimacy play a role in brain function. Emotional health, because isolation and unspoken shame chip away at confidence. And ultimately, your quality of life. The way you move through the world, the way you connect with your partner, and how you feel in your own skin. The truth is, you don't stop being a man when your body changes. You become wiser, more intentional, and more powerful when you choose to stay connected to your body and take care of it with clarity and respect. So if no one else has told you this recently, let me be the one. You deserve to feel informed, empowered, and strong at any age. You are not too old. You are not too far gone. And it's never too late to take back your health. One decision, one conversation, or even one video at a time. Call to action. Let's keep this conversation going. If this video helped you better understand your body or reminded you that your health still matters, do this. Click like, not for me, but so more men like you can find this information in their feed. Comment below, type yes if this message spoke to you. Type 0 if you still have questions or want more clarity. I read every comment, and your voice shapes the content we make next. And most importantly, hit subscribe and turn on notifications. This channel is here to give you weekly, doctor-reviewed content made specifically for men over 60, with no gimmicks, no judgment, and no nonsense, because your health doesn't retire, and neither should your confidence. You've still got more life to live. Let's make sure your body, your mind, and your spirit are ready for it. See you in the next one.